Hey everybody, it is Dorian Jackson, women's health nurse practitioner, your women's health advocacy coach. So stay tuned to the end of this video because I got a tip for you. But nevertheless, I wanted to just announce that on the website, heranswernow.com, I am now offering a new service. It's called an inquiry consult. What is an inquiry consult? This is our Make It Make Sense consultation. Now, y'all already know, we will go into the doctor's office. They'll tell us, okay, you have this, 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 and this. We say, okay, I understand. And come out of there not knowing what the world they talking about. Am I gonna die? Like, what is happening? We go on Dr. Google, and then we try to figure it out with Dr. Google. Dr. Google tell you all kind of stuff. You ain't never coming out good, Dr. Google. They always got you dead. And then we try to figure it out, and then we go in for follow-ups, and we still don't really understand the basics of what's going on with our body. So this consultation, I'm going to help you with that. What it is a one-on-one consultation with me where we talk about what you've been told, where I'll be able to educate you fully on what the diagnosis is or what really could be going on with your body. So that way, because you have education and understanding, you're better able to speak up for yourself, to advocate for yourself when you go back into the healthcare setting. So a lot of the fear that we'll have about things concerning our health is because we just don't know and we just don't understand. And to be honest, y'all, we are just not given that much time to be able to really sit and go through it bit by bit. Our doctor visits or the visits that we get when we get a schedule, they 15 minutes, y'all. No matter how complex, no matter how, who knows what, whatever questions, it's 15 minutes. So with this consultation, we'll be able to take 30 minutes to really dive into what you were told, what's going on with your body, so you will have understanding. I'll be able to give you tips on how to advocate for yourself and say, like, well, hey, to your healthcare provider, what about this or what about that? So you have the full understanding of what your options really are, and you have the full empowerment to be able to go into your next appointment speaking that same language and having some understanding about how your care should be going, what should be being done, what are best practices, and what options you have as far as what we gonna do about it. So this is for anyone who is pregnant or not pregnant. If you've been given a diagnosis about something or just something that you don't understand about your body and you want better understanding about, this could even be something that you're not comfortable speaking to your healthcare provider about. Things like issues with sex drive or, even for women who have never been to the OBGYN and they really want to have a better understanding about what's going to happen in that space before they get there. Women that have been diagnosed with abnormal or not normal pap smears and they've been told they need biopsies and what is that even about? If you really want to get more of a firmness in your foundation of what you're being told, what's going on with your body, this consultation is for you. We're going to make it make sense because it needs to make sense for you. It has to make sense for you. It is your body. And yes, we all go to healthcare providers, but we're responsible for what happens with our health and what we say yes to and what we say no to. And because we need those options to know what's really the best way to go for us. So you'll need to go onto this website, heranswernow.com, and book your inquiry consult. Sometimes, depending on the complexity of the case, we may need to do 2 consults. 30 minutes just may not be enough. But you definitely will come away with an understanding about what's going on with your body. You will definitely come away with an understanding about what your treatment options really are. And you will definitely come away with empowerment and knowing how to advocate and speak up for yourself. Because if we don't speak up for ourselves, then any old thing be done any old kind of way. So this is what I'm here for. This is what we do. In addition, when you book it, you have to put what the issue is in the comment box. Y'all don't send me nothing and it's blank because then I ain't gonna know what we talking about. And then I got to come on and we wasting time trying to talk about the situation. When that consult start, we getting straight to it. What do you know? What don't you know? And let's just talk it through and walk it through together. So that's what it's about. I'm excited. We're going to get this thing done so you can really take charge of your health. And women's health, it's not just, the breasts and the this and the paps and all of that stuff. Anything concerning your health as a woman, anything concerning your health. It could be your mental health and you went to your, mental health provider or your primary care provider and you're just not sure about medications, or now you're pregnant and you're taking certain medications and you just didn't get fullness of understanding to your satisfaction. So, if you just want something to supplement your knowledge, supplement what you already know, this consultation is for you. So, heranswernow.com is at. All right, now here go our tips. Now, y'all already know, in our late 30s and 40s, we can start getting them little hot flashes, feeling them little sweats. Like, what is this? Is this the menopause? Well, it could be the premenopause. And there's 3 things that can contribute to that. So our bodies, even though we're not fully in menopause yet, like we haven't gone 1 full year with no period, we can start getting them hot flashes anywhere up in them late 30s and them 40s, they could come through. So one thing that can increase your risk or increase your frequency of the flashes is caffeine. The other thing, spicy foods. Third thing, nicotine. So those 3 things, if you having some flashes and you're like, I don't like that. See what kind of lifestyle factors, like, do you drink caffeine every day? Are we Red Bulling it? Like, what we doing? Spicy foods, them cigarettes and vapes, like, what's happening? Because those things could be contributing to your symptoms and not making them any better. So that's just your tip. I'm Dorian Jackson. This is Her Answer. And I'm going to see y'all on them inquiry consults because y'all, we going to make it make sense. Till next time, take care.